My name is Charles Kokrode. I'm the Chief Officer for the Caribbean African Health Network, CAHN. CAHN was set up with a real vision to eradicate health inequalities and wider disparities for Caribbean and African people within a generation. So we're working extremely hard because we don't want to have the same focus in the next 20 years. We've gone 5, we're working towards another 25 years, by which our mission and vision should have changed because we would have achieved the objectives we set ourselves of eradicating health inequalities and wider disparities. So far, our mission has been making sure that the voice of the Black community is heard in the decision-making room, is heard within commissioners, service providers, and other spaces where decisions are made that impacts on us. We started in Greater Manchester from humble beginnings, and we're extremely delighted that with the support of our community, we're now working at national level, delivering in various parts of the country. There is much more to come. We're incredibly delighted to have enjoyed the mandate of the community. And so far, over the last 5 years, we've stayed true to our commitment of not competing with other Black-led organizations, but complementing what others are doing, enhancing what they're doing, standing alongside, advocating for our community, educating our community, but also educating commissioners and service providers. And it's been an amazing 5 years where we've worked incredibly hard. Just last year, we had the privilege of running a grants program for the first time in Greater Manchester, where we gave out $310,000 to Black-led organizations working across the Greater Manchester region. It was the first of its kind, and we're really ambitious and hoping we can do much more of that in the next year and many more years to come. But we need your support. So far, we've been able to support and encourage and enable, people with dreams realize their aspirations. We've provided support to other Black-led organizations. We've supported individuals to set up, charities and to do things to support community. During the pandemic, we worked our socks off, worked incredibly hard, right from delivering ethnic foods, buying that in bulk, giving it to groups, even to, COVID vaccine clinics in Salford. So we went right from information to putting jabs in the arms. And that couldn't have happened without our amazing nurses who give their time, as well as our doctors. We're already showing leadership when it comes to our community with the CATIP Health R. So that's a Caribbean African Targeted Health Improvement Program. And we're delighted that the lottery is funding that. And with that, we have 5 partners, 2 in London, 1 in Leeds, Birmingham, and Sheffield, extending the reach of the health literacy. Because there are things we could do with or without money. And making sure that our community is empowered and able to live longer with better health outcomes is why we were set up. It's been great, the support we've had from system partners, so health and social care, not just in Greater Manchester, but up and down the country. We're really grateful for all the partners who have supported our work and have commissioned us to deliver a range of services and programs. You've heard about some and you've read about some, on our website. But we want to be around for the next 25 years, making a real difference for Caribbean and African people up and down the United Kingdom. That is why we need your support. Your regular giving will go a long way. Keeping us in mind when you write your will will go a long way. But also, other forms of giving will go a long way to support us. We will keep working hard, and we need your support. Thank you very much for listening.